Hi, everyone. My name is Rayna, and I'm a board certified occupational therapist. Today, we are here with Dr. Mona Amini, who owns her own psychiatry practice called Monv Mind Wellness. She is based in Scottsdale, Arizona, and she is here to talk to us today and tell us a little bit more about her practice. Dr. Amini, thank you so much for being here. Welcome.
Thank you. Thank you for having me, Raina.
Of course. So would you mind telling us a little bit more about your practice?
Sure. My practice is a one-to-one concierge private practice for psychiatry. Monv Mind Wellness is the concierge practice's name. I'm based out of North Scottsdale, Arizona. And ultimately, my practice is focused on overall mind wellness. And what does that mean to the general public? Well, ultimately, I never wanted to just do a traditional type of private practice in psychiatry that is just focused on psychotropic or medications for management, of symptoms or diagnoses or behaviors. What ended up kind of coming to fruition was over time in my career, clinically, administratively, and through, my executive experiences in space, that there are a number of different things that need to be done for somebody to have a really successful longitudinal overall mind wellness. And what that means is there are components of therapy, lifestyle changes, dietary adjustments. It may or may not mean psychotropic medications as managing, some symptoms or behaviors. Supplementations, macro and micronutrients, and really looking at the overall person. I treat each and every person as a whole person. So anyone that steps into my office gets more of a customized type of treatment plan. And so some of my patients are not on any meds at all, or they might just be on supplements, and or we're doing much more of a experiential type of experience. I'm talking about sometimes like how fashion can help with your therapy and your mind and optimizing mental health, how music, for example, can help to optimize your mind and mental health. So very different, small steps and strategies that globally teaching the individual how to be successful over time.
Okay, this is so interesting because this is so much like occupational therapy, where
Mhm.
we are really taught to look at the whole person also, but we don't really have that background in the medication part or the nutrition part. So I think our fields really can work together. Um, Your practice also is focused on wellness over a
Yes.
diagnosis, which is like what we do. We don't treat based on a diagnosis. It's really dependent on the person. So, how do you feel like focusing on wellness can impact people's progress?
I really feel that, when we work in more preventative means rather than reactive means, I think that people progress so much more substantially, so much more significantly. But they have to invest their time into that. So in my practice, I am adults only. So I'm 18 and older in my practice, but that whole spectrum also spans a whole different, cusp of different generations. And with that being said, different generations are more accustomed to reactive type of medicine. Only when I get sick is when I'm going to go see the doctor. Or for mental health or psychiatric reasons, it's like, I don't want to see the doctor at all. I'm not that sick. I'm not that severe. But my whole focus is, well, it doesn't matter the severity of the illness. It actually doesn't matter your diagnoses. I am not treating the diagnoses. I am treating you as a person. And so if you're stuck, if you're having issues, if you're having, active symptoms or behaviors and you need help on that, and then not only in the time being, but also preventing future events or knowing how to navigate those future potential stressful events. How amazing would that be to understand what that journey is going to look like and be prepared for that potential season of change? So I think that we are trending more in this nature because just healthcare in our society right now, and with the younger generations, particularly Gen Z and Gen Alpha, they are much more inclined to focus on their health and wellness and just overall well-being, and are more advised to not use substances or drink, and are avoiding certain things that maybe the older generations had done to self-medicate and, you know, were not really healthy coping mechanisms. But now with all of this social media and these interventions and all of this opportunity for education just coming their way consistently, how amazing are we seeing these trends going to more of the proactive and preventative means, especially for mental health? It's really exciting.
It is. Yeah, I've definitely seen in the people I treat and just in general, there's just so much more accessible education about mental health.
Yes.
And sometimes maybe it gets caught up and there's a lot of differing opinions out there, but people are
Hmm.
more interested in taking things into their own hands and educating
Hmm.
themselves, which is exciting.
Right. I actually started my platform in social media about a year, year and a half ago for that very reason, because not only were the trends kind of falling into very different, lines of, well, are these really strategies for mental health? But I wanted to be a sounding voice and provide not only, a vision of like destigmatization of mental health, that you can be fashionable, you could be sophisticated, you could be fun and still be a psychiatrist and a therapist. And here are practical tools that you can use for your everyday. Particularly that my focus mostly is about music, fashion, and all of the things intertwined. But that's from personal experience. That's also from experiences that I've had with different patients and the tools that we've used that have garnered them success overall in their lives.
Right.
So we can utilize platforms to our benefit as providers and, therapists and whatever we're doing. And that helps a whole other subset of people.
Yeah.
So,
Yeah,
and that's really meaningful.
definitely. Because you're bringing in people who might not identify with a very
Hmm.
clinical, buttoned up
Yeah.
kind of medical treatment. Yeah,
Yes.
I definitely agree. Um, so I wanted to ask you about kind of how our professions kind of merge, like the overlap, the middle of that Venn diagram between OT and
Mhm.
psychiatry. So what we do a lot of is build habits, and we do focus on prevention, um, starting at younger ages, trying to open up people's opportunities and help them with what is hard for them, basically. Um,
Right.
develop those self-confidence skills to find a job one day, or in our case, at our practice, we're specifically focusing on teens with autism. So I think this can be a really good age to start building some of those preventative habits for wellness. How do you feel like our practices kind of merge and how they can work together?
I love that with OT, you're in more of a preventative, kind of subset of providers and working on these strategies for teens and adolescents. I think, especially now in today's society, knowing that intervention earlier rather than later is the key to focused success overall. In any setting, it doesn't necessarily mean for neurodivergent individuals. It can be on any level, practically in healthcare and mental health. But What I appreciate is the different approaches and how, like you said, it's like a Venn diagram for each person, and you're treating them on a subset of different tools and helping them with that. And really, ultimately, you're working on as a team, some strength-based approaches. You're working on lots of skill development that maybe they didn't know that they needed to work on at such an early age, but you're training them for adulthood later on and training them that, you know, social communication and their social development is really ideal, and especially at that teenage age where social cues are important. Setting goals, setting that roadmap of what they want to do in their life, not only in that little, short amount of time as a late teen, but also early adulthood and then beyond. You often get families involved in this as well and kind of supporting that. And I feel like OT, just in general, they almost serve as mentors in a way. And you're helping this patient on a very different level than just a general therapist would, like a child or, mental health therapist or even a psychiatrist. There's a lot of different cusps of education that you deliver on. I call it like a snack bar level, very little spurts of education for them to have this really great outcome overall at the end, of your program or upon completion. Once they get older, and these are all skills that they'll be able to use for the rest of their life.
Right. Yeah, just building those small skills that lead up to
Hmm.
those bigger foundational things.
Yes.
Do you ever work with people on the autism spectrum?
I do. The adults, early, young adulthood patients, or even on towards the latter part of their like midlives as well. Sometimes individuals, especially now that we're becoming a bit more open in communication about neurodivergence and what does that truly mean, and maybe you had this diagnosis that you didn't know that you had, and looking into that a bit more, having a bit more research and screenings and things like that. So I have had patients, um, and or do have patients, but it's a very different patient population, and then I actually really enjoy them because they're usually really invested in their care because they want to build on their skills,
Mm.
because they really are full-fledged, wanting to learn about the next steps of like how they can be successful in their career and make that next leap and have a newfound relationship or partnership with somebody as well.
Yeah, and those are the best type of patients that really want to
Yeah,
do the work.
yes, yes. That's the most ideal for me.
Yeah.
That's the ideal patient ultimately. I don't want I don't want patients thinking that it's just about a med refill and a med check and then send them on their way. No, it's about a lot more than that. A
Hmm.
lot more.
Yeah, it's definitely, you have to have that internal motivation to really see
Hmm.
results.
Right. Yes.
So, do you see, we see a lot of comorbidities with autism, like anxiety and depression. Do you have any insight as to why that is?
Yes, so there's a lot that fall into the spectrums of just neurodivergence and autism, Asperger's in general. We tend to see a lot of depression, anxiety, obsessive compulsive disorders, and there's a number of, different multitudes of scientific research to attest to that for the reasons. But I'll say that in generalized, like simplified versions, there's a lot of reasons for why they may present with these. And a lot of that has to do with they might have some negative past experiences. A lot of these children, especially in grade school, were bullied. They've been probably dismissed by other individuals, not really a part of like a subset of a group or anything. They might be in different types of programs that are outside of the general student population, which isolates them even more. So those are kind of like the social challenges that they've faced at a very early age. And then forming relationships and friendships beyond that is very difficult because you're either really, really isolated in a very small group, and those individuals in your classmates may not be your same age. So you may be a fifth grader, but you're hanging out with the third and second graders, for example, which is harder to fit in. And there's a lot of pressure right now just in society for these youngsters in general to fit in, and the social media side of things, and lots of comparisons. And that eventually means that they can get emotionally exhausted. They could get burnt out from all of this isolation and all of these push to, fit into this like subset of the cliques and relationships and friendships that are formed. And then you add to that like all of the uncertainty, all of the changes that can be made in school, and any changes in your routine. So when you're elevating in age and when you're elevating in school, you're not in just one homeroom anymore. You might be changing classes for your biology, your science, lab, art, etc. And those can garner some anxiety because it's a change. It's a change of classroom, change of teachers, all of those routines. That creates a lot of anxiety, distress. And then add on top of that the sensory difficulties that they may have. And so those environments where you've got a fire drill, for example, in school, that may activate them a bit more, very overstimulated, lots of stress, lots of anxiety related to that. So unfortunately, having that understanding that these things may come about and being more preventative in it, and helping the families understand here are the triggers and here's some signs that these are potential major depressive disorder symptoms, or really generalized anxiety, or really, obsessive compulsive disorder types of symptoms. This is when you would treat it to that severity. For how long, that's dependent on what professional they're working with.
So it's really sounds like a process that can start from when you're really young, whether it's
Mhm.
educating the family or helping the actual individual learn tools to help them kind of prevent some of those
Yeah.
triggering events.
Yes. Yeah. If you can prepare them for how to navigate forming new friendships, how to navigate um, less of the social anxiety, going into a new group or going into a new school, new setting. And then also navigating the stimulation and overstimulation, maybe not going to public settings when it's like a happy hour type of experience where everybody's coming at once and staying for the next hour or two. Maybe, stepping away from that and knowing that maybe shopping later in the evenings with your child, going grocery shopping or doing it otherwise will still help. They'll get outside. They're in the public eye and setting, but it's not as overwhelming. You're not in lines at the cash register and dealing with that process.
Right. Just making modifications to make it
That's it.
better.
Yep,
Mhm.
exactly.
Yeah. Um, so what would some of our clients, they're teenagers or young adults,
Hmm.
maybe they've been out of school for a few years, and we find that a lot of teenagers on the spectrum, because of their, um, because of all the things you said, the overwhelm and the different social experiences they've had, they have a hard time getting a job or making friends as adults, um, sticking with their college classes, which are, they take a lot more of that internal motivation. What would you say to one of those people who's just kind of stuck in their situation. Maybe they're just at home most of the day. They are having a really hard time getting out of that routine.
Um, Ironically enough, I was having a conversation about almost this exact same thing last night with somebody, not about a neurodivergent patient, but just in general. I think right now, where we stand again as a society is there's constant comparisons that if you're not if you're not busy at all hours of the day and you have like 14 jobs, you're not doing enough, right? So the intention is not to be working 90 hours a week. The intention is to even start and like start somewhere, I should say. Start with something. And what I tell people, and this was what my conversation was about last night, was you need to meet them where they're at right now. We don't expect somebody that is currently kind of more stagnant at home, maybe playing video games, very isolated, doesn't want to have any social interaction with anyone, suddenly become the staff member at a Target and imagine the social interactions on like incessant setting for them. That will make them so anxious. They are going to be incredibly panicked just walking into their onboarding and training. So we need to meet them where they're at, wherever that is, and we find their strengths. So I'm sure you do this on your setting and in OT, and that you're doing a lot of like goal setting. Where are we at visually? Where are we at in a more like concrete setting? How are we going to script your future? And you talk about these things where they're kind of making vision boards of themselves and where they feel they're at right now, where they want to be in maybe 6 months, years from now. And they just need smaller goals to just be laid out for them rather than just throw at them this like one long-term big goal. I want to go from this to med school. Well, there's a lot of work into that, right? In between. Um, with any neurodivergence, and honestly, with any teenager at all, with or without neurodivergence, their executive functioning is still being developed. And so that frontal part of their brain is still somewhat disorganized. So you're just trying to align those things with structure, and that can just mean supporting them on every level with that. Sometimes we're working on timelines and apps, lots of calendars, lots of post-it notes, notebooks, and teaching the planning side of things, problem solving effectively. And then the mindset goes into that. And what does that mean? We're just reframing things. So if you fail at something or you didn't get that job that you applied for, well, there's numbers of different jobs out there in the same industry. So keep trying. And it's about building on that resilience and teaching them that, one failure or one no, even though there's 15 of those no's, eventually you knock on the door and there will be a yes. And just knowing that and kind of continuing to give them that prompt and give them that optimism and support. Sometimes really that's the push that they need because they're not getting that potentially from family or their support network. Um, and that kind of falls into again the family systems, the friendships, the support networks that are around them, and what does that mean? How do they feel supported, and are they really supported? And if not, then is there a mentor that they can find? Is there somebody that's maybe older that's neurodivergent that has been successful that can kind of take them under their wing and kind of show them the way? How did they develop all of these skills? And with anything in mental health and really physical health as well, it's time consuming, but it's about consistency and it's about practicing these skills every single day.
Yeah. this is not a quick fix for sure. It's
No,
a long
never.
journey.
Yes.
Yes, absolutely. I definitely agree. And this is kind of goes back to what you were saying with just from as children, a lot of neurodivergent people are taught to kind of fit in and fit into this world that we have,
Yeah.
when really we should be kind of trying to figure out how to work best with them and the way their minds
Yeah.
think. So, yeah, I definitely think all of those strategies are really things that we talk a lot about too, and things that really do work.
Yeah. I think we're becoming a bit more of an accepting society. I'd like to see it get better. But with information at hand and with a lot of great people such as yourself and a lot of different foundations now that I'm seeing, nonprofits that are informing the general public, that are doing really, really great work at even just the screening process. Not only that, but educating on where to go when you're lost or the family, your parents are lost. Like, what do we do now? Because my child is not fitting in. You know, he might be 5, 6 years old and you're seeing a little bit of changes suddenly, or you kind of knew something was going on before, but now you're pretty dead set on this particular diagnosis. So, where to find those support systems? There's so much more out there than when I was, in grade school. So, I think there's different opportunities, different schools now. And I think there's a lot more support than what was out there even just 10 years ago. So that's a good change. That's makes me a bit more optimistic about the future.
Me too. It's definitely it's encouraging. And I see more young
Yeah.
people feeling more and more accepting or, being more
Yes.
accepting towards different types of people. So it's a good thing for sure.
Yeah,
Well, thank you
exactly.
so much for meeting with me and talking to us. It was really nice to meet you.
Likewise. Thank you for having me today.
Of course. And if you'd like to learn more about Dr. Amini's practice, can we get the name of your website?
Absolutely. Yes. So again, it's Monvi Mind Wellness is the practice name. But online, if my website is monaaminimd.com. So MONAAMINIMD.com. And I would love to hear from your listeners and fully support you and your practice.
Great. Thank you so much. Well, we'll have your website linked in our video description too, so
Okay.
they'll be able to find you.
Thank you so much, Rayna.
Thank you. Have a great day.
You too. Thank you.
Thank you. Bye.